Welcome back after a fascinating morning's of inputs. We've got, I would say, an equally stellar cast this afternoon. There's been a slight change to your published programme. Unfortunately, Matthew Barcraft-Barnes isn't able to join us, but the upside to that is it means we get more time from these two gentlemen. The themes we know is violent crime. They're going to give us two very different perspectives. The first, by DI Ahenkora Bediako, is going to be about county lines. And then we're going to have Chief Superintendent Trevor Lawry, who's going to be talking about knife crime. They're both graduates of the course, so they know what you're going through. Because we've only got two speakers rather than three, it means they've got a little bit more time than they would have had initially, which is great for us. What I'm going to do is they're going to have sort of 20-25 minutes each, and then we'll have a joint question session at the end. So when Beds has finished his bit, he'll hand over straight to Trevor. But gentlemen, thank you very much indeed.
As you said, I'm Ahenkora Bediako. I'm a DI in the Metropolitan Police. And for me, this was all about risk assessments for operational officers. So 2 quick points before we start. Sometimes I struggle to pronounce my words, because I've got dyslexia, just so you're aware. And I have referred to individuals in the sample cohort as nominals, because that's how we refer to them in the Met. So why did I do this? Or, in the words of Sir Dennis, so what? We know that there is some kind of connection between serious violence and drug trafficking. And so these two individuals will be familiar to most of you, particularly the young chap on the right, Javid Moody, stabbed to death at 14 whilst selling drugs. Probably less familiar to you are Majulin, who actually stabbed him, who was 18 at the time. And, you know, I was reflecting on this week, and it's really interesting when this was reported, because Ayub was described as a man. And, you know, looking at our penalties that against Italy, and Saka, who was 19, was described as a boy in the reporting. It's just really interesting. I was just reflecting on that. Just a really interesting point. So I've worked as a DS in a missing persons unit in the Met. I'm now SIO on modern slavery, child exploitation. I've directly witnessed how difficult it is to manage this kind of risk and the wider issues connected with this kind of drug trafficking. So I was motivated by a desire to give operational decision makers something tangible in trying to predict the serious violence that's happening. So, my research question was, can risk and protective factors for suffering or causing crime harm be identified among people suspected or known by police to be involved in county lines activities? Or, in plain English, what things make being a victim or a suspect more likely? Okay, and then I separated it into 3 parts. So, the first part, are there any lower super output areas in which known county lines nominals are more likely than others to suffer or cause high crime harm? B, what is the distribution of various characteristics of county lines nominals? And C, are there any combinations of high conditional probability factors that make high harm causing or suffering even higher? And what that basically means is, are there characteristics that when we combine them, the risk of suffering or causing harm gets even higher? So the broad answers to what I found. So the first one was surprising when we look at lower super output areas. The more nominals present in a super output area, the less harm those individuals are associated with. That was a surprising finding. I should say as well, I'm not presenting this as something groundbreaking. I think a lot of it will make sense, and I think some of it will confirm a lot of what we know. But there were some surprising results. This was a surprising result. Also, I'm not presenting this as conclusive. I'm just saying this is what I found in my data set. So I found this unusual correlation, which we'll go into a bit more detail later. The second bit The distribution of characteristics, no surprises here. Overwhelmingly, nominals were male, a large proportion were black, aged between the ages of 18 to 25. The black and white nominals accounted for most of safeguarding and missing person reports. And nominals generally were associated with more suspect than victim harm, so more likely to be suspects than victims. And then part C, so simply put, the factor that meant that people were more likely to become victims was being a victim previously, before they came to notice. And also, another factor that was significant in being a victim was the number of times someone had a safeguarding report recorded about them. And then for being a suspect, being a robbery suspect was a significant predictor for then later on becoming a violent suspect. So how did I do this? County Lines Intelligence Collection Matrix, or the CLICM, which I've described as the most comprehensive record of county lines intelligence. So for those of you not familiar with it, it's essentially a list that's administered by the National County Lines Coordination Centre. Individuals across the country who are identified as being in county lines, involved in county lines, are put in this matrix, and then it's periodically disseminated to each police force. So for me, what I was interested in is, I'm just getting my little pointer, I was interested in this point, the point that people were added to the county lines collection matrix. I then looked at 365 days after they were added, which I've got here, and compared that to what happened before they were added. And I also annualized it. So I divided whatever happened before they were added by year. And so the whole intention behind doing all of this was to try and predict what happened after they were added based on what happened before they were added. So this is my data set that I ended up with. So one thing about the CLICM is that each time someone comes to notice, they get added. So there's a lot of duplicates. So you can see here, these were the duplicates that I had, quite a few. I removed them all. Then I set my range, which you can see here, 1st of September 2018, 22nd of March 2019. Now I chose the 22nd of March 2019 because that was exactly a year before lockdown came in. So by doing that, I avoided the effects of lockdown. So essentially what that meant was I ended up with 1,771 individuals in my cohort. So that was my cohort I was looking at. Then what I did is I got our analysts in the Met to extract all the data, the crime data, the missing persons data, safeguarding data, to create my data set, which you can see here. So these are all the reports that I got, and it was in an Excel format, so various Excel spreadsheets. And then when it came to actually calculating the probability, there was a number of calculations that I used. This is just one of them. So here, the conditional probability, the number of nominals with a risk factor who had an outcome over the total number of nominals who experienced that outcome. So if I decided, for example, that being a habitual knife carrier was a risk factor I'm interested in, and I look at the people who are listed as habitual knife carriers, who either were suspects or victims, and then I'll divide that by the total number. So, yeah, hopefully that will become a bit clearer later. Now, on to my actual results. So, in terms of the lower super output areas, what this is showing you is that most of London's output areas don't have any county lines nominals in them. And then as you get more and more nominals, the amount of output areas goes down, which is to be expected. But then this is where it got interesting. So as I said, harm per nominal per year. So here we've got two graphs. The top one is victim, The bottom one is suspect. And you can see this slight correlation where the more nominals you have in an area, the lower the harm per nominal. I wasn't expecting that. And it's the same for suspects. So this is before people were added to the Clickham. Now this is after they were added. So in the year after they were added, so for suspect harm, there's that slight correlation again. Here it doesn't really hold. But as I say, it was just something that I wasn't expecting to see. So moving on, the distribution of characteristics. I don't think there's any surprises here. So what you can see here is age at the bottom, number of nominals on the side, and then the different colours are different ethnicities. And that's using IC codes. So the main thing of interest for me, if I zoom in, is that looking at the ages, so from 19 to 21 is kind of where you get the peak, no surprise. But also this big grey area in the middle, that's our black nominals. Again, no surprise. So moving on. So this is something else that I looked at. It was the number of missing and safeguarding reports per person prior to them being added to the Clickham. And again, I divided it by ethnicity. So what you see right at the end here, this is everyone. So what you see for black nominals and white North European nominals is they're slightly above the average. So again, just an interesting finding there. And then finally, so what this is showing is that essentially, in my data, individuals were associated with more suspect harm than victim harm. So that's why it's all kind of bunched to one side, because at the bottom is victim harm. So if there was a lot of victim harm, these would be spread out along here, but they're not. They're all kind of around here. So again, county lines nominals that I looked at, more suspect harm than victim harm. Okay, so this is where things got interesting. And essentially, to explain this simply, this is showing the difference in risk for particular factors that I selected versus not having those factors. So basically, for each one of these things that I've selected down here, the difference between these two lines, the bigger the difference, the more risk for that particular factor. So right at the top, we've got 5 or more safeguarding reports before you've reached the age of 18. So for any individual that receives 5 or more safeguarding reports, in my data, they are most at risk of becoming a victim. And this number here, 4.9, is the relative risk ratio. So it's comparing these two lines. Basically, it's saying you're 5 times more likely if you had 5 or more safeguarding reports to be a victim of violence. Now, all of these that I've put up here, I mean, I did more than this, but these are the ones that I found were interesting. So looking at some of them, some others of them, we've got male, previously a victim of any crime, and under 26, 4.7 times more likely. South Asian male, who's 18 between 18 and 25, just over 4 times more likely than not being those things, those combination of things. So what does this mean? In summary, I would say an optimal targeting strategy, based on what I found here, is that if you focus on males who are under 26, previously a victim of crime, or any person that has had 5 or more safeguarding reports at the point that they're added to the Clickham, then you would target 63% of your future victims. So by targeting less than a third, you can get almost 2/3 of your victims. So I'm not talking about what type of intervention you might use. I'm just saying, if you have an intervention and it's resource intensive, you only need to look at just under a third of your people to get potentially who would have been 2/3 of your victims. So then moving on to suspects, I did exactly the same thing. So right at the top, you can see robbery suspects. Now, there's something really interesting about this finding at the top. So there were 77 robbery suspects in my Clickham data. All 77 of them became suspects of violence within a year of being added. And that was the only factor that had such a strong finding. So my optimal targeting strategy for suspects with this imaginary intervention: any person that has been suspected of a robbery offence prior to being added to the Clickham, or any person who's been charged for any offence, excluding traffic offences, prior to being added. And if you do that, you'll get just under half of your cohort, but you would correctly target 72% of future violence suspects. So what I'm saying is, if you get a dissemination of the Clickham that has 2,000 people on it, using this strategy, you can look at just under 1,000 of them. But all of the serious violence that was going to occur in the next year from that cohort, you can capture 72% of it. So it's all about this optimal targeting. So, coming to the end, in terms of the implications of this, the obvious one is the first one, which is decision makers can focus our resources on fewer individuals. Now, as I said, I'm not saying this is conclusive, I'm just saying this was for my data set. I think this could be applied to any data set, any list, where there may be risk involved. I personally think, having looked at a few risk assessments, that we'll do well to start differentiating between the types of risk we're talking about, not talking about risk in the general terms. But so for me, I separated it into victims and suspects. Ethnicity is a significant factor. How do we factor that into our risk assessments? It's a difficult one, but I think now more than ever, it's something we need to focus on. So yeah, and I expanded on this a lot in my thesis. It's too much to go into now, but I think it's something that we really need to look at. I feel that the role of urban street gangs in county lines, it's a big deal, but there's other more impactful factors that we also need to take into account. And then finally, in terms of policy, we should use this kind of statistical modelling more often. And then in terms of further research, what I personally would be interested in is how does risk decay after certain events. So after someone goes missing, after someone gets arrested, after someone gets charged, is the risk constant or does it change? Does it reduce over time? And then the riskiness of those factors. So I've showed you my risk factors that I came up with 10 years ago. Were they the same factors that were that risky? So if we think about hotspots and how they stay hot over time, does the same thing happen with risk factors? Or in 5 years, will it be a different set of risk factors? I wonder.
Afternoon, I'm Trevor Lawry. I'm a Detective Superintendent with the Metropolitan Police Service. Okay, I'd like to talk to you this afternoon about predicting victims of high harm knife crime using their prior histories of victimisation and offending, but specifically to forecast the highest risk of serious and fatal injury, and I'll come on to that later on as to why that's been chosen as opposed to anything else. Beds and I were put together in order to do this presentation, but interestingly we haven't spoken about the presentations and we haven't looked at each other's presentations, but it's interesting, having sat and listened to Beds, how much they complement each other. Unfortunately, unlike Beds, I'm not quite as good on PowerPoint, so you won't get the zooming in and zooming out and the pointers and things like that, so I apologise for that one. And just listening to Beds, I thought I would reflect on the first thing that he sort of spoke about, which is why he decided to do the study he did, because I've not included that here, but it is useful, I think, because I decided purely to focus on victims, and I decided that because I sat where you sat, or you're sitting now, and thought, there's some really great people that have gone before me. Where do I start where there aren't so many people that have gone before me, so that I'm not going to make a complete fool out of myself, and victims seem to be the area to go for. But on reflection, actually there's very limited information, and it seems to be an area whereby the victims actually are lost. We talk about offenders, we talk about places, we talk about guardians being in places, but we very rarely talk about the victims. So I wanted to do something around victims and look at victims specifically to see whether or not we could do something around targeting them. So, what's the study about? The study is about all knife crime victims, excluding domestic abuse, between the 1st of January 2015 and the 31st of December 2019, so it's over a 5-year period. It was in London. It included 54,475 victims, which I think is probably one of the largest pure victim studies that I've certainly come across. And for any of you that have worked either in the Met or tried to work with the Met, you'll realise that our systems are at best clunky, at worst almost impenetrable. But what I did was I took those 54,000 victims and I run them back through our systems to get all of their offending history. I then rerun them back through another one of our systems in order to get all of their arrest history, through the stops database to get all of their stop and search history, back through Chris again to get the victimisation, and then finally through a system called Merlin to get all of their vulnerability history. And having done all of that and put it all onto an extremely large spreadsheet, I took a decision that I would limit anything of their history to 2 years prior. The reason being was that gave everybody an equal chance of having something occur within that period. I did, however, take the decision that on vulnerability, I would include their entire history from birth. And the rationale for that was most vulnerability, certainly recorded in the Met, is vulnerability around being a child. So it tends to be going missing, it tends to be child welfare. And I decided, or I thought very much, if I was going to deal with offenders that are victims that are 25 years old, if I only went 2 years back, the likelihood is that they wouldn't have anything on their vulnerability history. So there is a limitation there. Just before we talk about knife crime, there's a few things I just want to put out there, because knife crime is not a crime. And we need to understand this. It's actually a special code within the Home Office counting rules. So knife crime does not exist per se. And in this study, there was 51 different types of crimes. And that ranged from dangerous dogs at one end to homicide at the other. And it's an issue, particularly around knife crime, that creates a difficulty in understanding and how you start to look at and really dig into what is knife crime. The next thing to realise is the possession of a knife is a crime, therefore it's not a knife crime. And if you look at most literature, when it talks about knife crime, what it really talks about is possession. So at worst, they're just completely missing the point. At best, they're not referencing it. But you really, in order to think about knife crime, we have to put possession of a knife to one side. There doesn't seem to be an awful lot of literature that truly makes the distinction and articulates how somebody goes from possessing a knife to using a knife and stabbing and killing somebody. Now, that's not to say that it's not there, I just haven't seen the literature around it. Most knife crimes are in fact robberies. So 57.3% of all knife crimes are robberies. Most knife crimes don't result in any physical injuries at 54.8%. And serious and fatal injury accounts for 11.5%. So out of the 54, and let's say 54,500 for ease, 6,253 of them were either seriously or fatally injured. So just over 10%. So when we talk about knife crime, we quite often talk about what the media is talking about in terms of knife crime, and they're focusing on this sort of 10%, not on the other 90% that sits behind it. Okay, quick guessing game. Anybody want to let me know what that is? No, that's a knife. According to the Home Office, that's a knife. Axe, that's a knife. Bow and arrow? No, that's a knife. Knife? No, that's a screwdriver. I don't know what you're teaching them, Larry. That's definitely a screwdriver. Unless, of course, it's been sharpened and then it's a knife. Okay? And this, again, it illustrates for me the difficulty of knife crime. Because if you think about the HMIC have come in and done a crime data integrity on our crime recording, but they're looking purely at crimes. They've never ever come in and done any work that I can find out about our recording of knife crime and Home Office special codes. So there is the potential that we could be under or over reporting a vast number of knife crimes based on, do you, as I would imagine the vast majority of the people in this audience are probably police officers, did you know that if you're going to record a knife crime that these things are included as well? Because I certainly didn't, and I'm pretty sure most of my cops are on the street probably don't either. The Met certainly don't have a sophisticated system where it prompts you to do that, to record them. What the Met does have is it has a team that does check all knife crimes to make sure they're correctly recorded, but that's only if somebody's identified it as a knife crime in the first place. So, if we just move on then to a little bit of the demographics and a bit more about the study. Males make up 80% of all knife crime, which isn't unsurprising, but that rises to 95% when you look at serious and fatal injury. 51% of victims are aged between the ages of 14 and 27, with 16-year-olds being the most represented. Now, there's a lot of debate going on, certainly within the Met at the moment, around victims becoming younger. And there's been several instances of sort of 15, 16-year-olds in the last couple of weeks, unfortunately, being fatally injured. But actually, over the last 5 years, it's showing that 16-year-olds are the most prevalent victims. So it's not unsurprising. I think it's just shocking, and it should continue to shock us. When we move on to ethnicity, what you find is white European is by far the greatest ethnicity found in all knife crime. However, that goes down when you start to look at serious and fatal injury, and probably more importantly is IC3 or black Afro-Caribbean individuals go up. So what you have is that black individuals account for 23.2% of all knife crime, but over 45% of serious and fatal injury. And that was replicated in Massey's study when he looked at homicide over a 10-year period. He saw a larger proportion of people being of black ethnicity that were killed. So, moving on to some of the risk characteristics, and I'm wincing slightly because I realise I've put conditional probability there, and Larry's now in the room and he's going to tell me off at some stage because this isn't conditional probability, the next one is. But anyway, when I look at the risk characteristics that were found, what you find is we quite often talk about victims of crime living and dying by the sword. But when you start to dig into what their characteristics are, you find that most of the characteristics that are going to be prevalent in those people that are killed or seriously injured are actual victimisations, and they're violent victimisations. So they've either been a victim of violent crime or they've been a victim of domestic violence. Now, if you then consider where the vast majority of our age group is, because they're going to be under between that 14 and 27, that's quite surprising, because of course you can't be a victim of domestic violence until you're 18 unless you've been in a marriage or intimate partnership. So it seemed to be slightly askew, but that's certainly what came out. Actual offending only kicks in right at the bottom for prior offences for violence. So the prevalence of you live by the sword, you die by the sword, isn't necessarily borne out. Now, you may have found and you may have seen or spotted when I looked at the histories, I didn't include the gangs matrix and whether or not people were on the gangs matrix. And I took a conscious decision not to include the gangs matrix purely because I didn't feel at the time, for two reasons. One, getting my hands on it for the number of victims that I wanted to put through it, I thought was always going to be difficult. But more importantly, I wanted just to know what their offending history was, not whether or not they'd got information on the gangs matrix, because I couldn't necessarily have made the distinction about what that really meant. But if we then turn over to the chart on your right, and look at combinations of probabilities, you find that vulnerability comes in really strongly. So if you've been prior missing and prior robbery, so that's robbery offending, so you've got prior missing episode and a prior robbery offending, if you're going to be a victim of knife crime, you've got a 39.7% chance of it being serious or fatally injured. And as you work down that, you see prior missing and prior serious violence, 38%, prior child welfare. So you start to see that vulnerability is quite influential in this. Now, this gives you no idea of scale. I can't tell you how many people in the general population that are wandering around London at the moment that have got those combinations of characteristics. What I can tell you is the fact that out of the 54,500 that they are so low, it seems to suggest that it's probably quite low in the general population. And some indicative work that I asked to be done around prior missing and prior robberies suggested that in London, over the course of the year, it's in the low hundreds. So it's definitely an area, from my perspective, that is worthy of additional research to see whether or not you can start to use that as a forecasting aspect. So, repeat victims. You'll see from there that the number of times a victim is, the number of times somebody is a victim of knife crime is actually really low in terms of repeat victimisation rate of 3%. That's not to say that some people don't have more than one incident, and don't forget this is over a 5-year period, so 3% over 5 years isn't a great deal. I mean, there is, I think one female had 9 incidents and one male had 10 incidents. But yeah, they are real outliers. And the number of times somebody is a serious and fatally injured knife crime victim, repeat victimisation rate is 1%. Probably not that surprising, because actually, if you've been seriously or fatally injured, you're either dead, so unfortunately you're not going to be a victim again, or you've been so seriously injured you're going to be out of the game for a period of time. But it's very low, and it does lead you to the question of, if you have a victim of knife crime and you put an intervention in afterwards, is there much point? Because they're not likely to go on to be a victim again. Now, arguably, that may well be because people are putting interventions in afterwards, and we don't know that, and we can't ascertain that. And it may well be that their teachable moment is actually the incident of knife crime itself. And it's again an area where we want to say, do we want to put lots of effort into people that have already been victims of knife crime? Because if they've already been a victim of knife crime, what's the chances of them being another victim of knife crime? And that's where I wanted to go to next with this study. So what I did was I looked at the conditional probability of being serious and fatally injured, and I took 2 periods of time. So I took period A, which was the 1st of January 2015 to the 30th of January 2017, and I said, let's look at all knife crime victims in that period, and that works out at just over 23,000. And then I looked at how many of them went on to be serious or fatally injured in period B, which is the 1st of July 2017 to the 31st of December 2019. So both have a 2.5-year chance. So those people that were victims in period A who go on to be serious or fatally injured in period B. And what you find is out of the 23,256 victims, 111 go on to be serious or fatally injured, which works out about just over 0.5%. So again, if you're going to tackle all 23,000 and put some intervention in, somebody, 1, needs deep pockets, to an awful lot of time, and you're not going to get an awful lot of reward out of it. However, if you start to put in some of the victimisation or offences, you can start to see that you increase your chances quite dramatically. So, for instance, if we come to the bottom of this graph where you've got prior weapon stops, prior drugs and prior robbery, you see for prior offences of robbery, you've got just over or just under 9%, which means you're 17 times more likely to work out who it is that's going to go on to be serious or fatally injured. And if you put robbery and drugs offences together, that actually increases to 44 times more likely. However, I would caveat that because you're actually only saving 4 victims. But if you can save one of them, I would suggest you're in a better position than the position that we're currently in. But you would be 44 times better. If, however, what we do is we take anyone with a prior history of robbery offending, or a prior history of drug offending, or a weapons stop, and take all of those people and say they're the people we want to put intervention into. Now, I'm not telling you what intervention is the right intervention to put into them, because this for me is an exploratory piece of research that starts to say this is how you target the right individuals. But if you take all of those people together, you end up with 595 people. But what you find is that you end up 8 times better at predicting serious and fatal injury. And it has a false positive rate of 96%, which you would say is potentially quite high. But crucially, what this does is it reduces the number of people that you have to put the intervention in by 97%. So it brings that 23,000 that you would have been putting intervention into down to 595 people. And of those 595 people, 40 of them will go and have a knife crime injury within the next period, so the next 2.5 years, 24 of which will be serious or fatally injured. So 20% of the overall total of people that you could capture and try and put some sort of intervention in order to do something and change their behaviour, change their lives, change their lifestyle, will be captured. Now, 595 people may still sound like an awful lot of people that you've got to put intervention in, but just to put this into some sort of scale and some sort of context, that would be 595 people over the course of 2.5 years, which when broken down actually means about 20 people a month. It's just less than 20 people a month. Bearing in mind that there's 32 boroughs in the Met, so there's less than 1 person per borough per month. It seems doable to me. Conditional probability for any sort of knife crime, the chart is there to say that you, by saving people that have been serious or fatally injured, you also sweep up some people that would just be victims of another knife crime, which in itself would be useful. It's likely that most of those would be robbery offenders, robbery victims. So anybody that's got a robbery problem may wish to want to extrapolate some of that information out. So, finally, the Sir Dennis O'Connor question, and Dennis is looking very fine there at the policy exchange. So what? So what? And I put the scales there because we talk about a public health approach to dealing with knife crime, but when we talk about a public health approach to talking about knife crime, we quite often, quite quickly, talk about how do we deal with the offenders. We very rarely talk about what can we do with the victims. Now, if you think about a public health in its broadest terms, it's some way of getting upstream to deal with, to tackle the issues, to stop the patient from getting ill. The question being, who is the patient? Because is the patient going to be the offender and solely the offender, or are we actually going to start talking about the patient also being the victim? Now, like I say, I haven't come up with interventions, but this is a way in which public health could start to tackle some of those interventions. For me, there is a benefit of review. So this study has said looking backwards allows you to identify things looking forward and forecasting forwards. I've put multi-agency there because vulnerability comes out quite strongly in its predictive factors. or its risk characteristics. Vulnerability is not something that the police routinely catch in the same way that education catch it, in the same way that health catch it. Truanting, being excluded from school, being a multiple attendee accident and emergency as a youngster would all add to the weight of that information. We have risk assessments for domestic abuse. We have risk assessments for many of our work. We don't have risk assessments around this aspect of knife crime. And it's something that definitely, as far as I'm concerned, can be developed. As I discussed earlier on, this hasn't been a particularly easy piece of work because of the clunky systems that the Met have. That's not to say that there isn't an opportunity for those forces that are on Athena and those forces like ourselves that are going on to Connect, which is part of the Athena project, where you have a poll database. This type of work becomes so much easier because you're extracting one set of data. You're not having to do the calculations and the matching. Which comes down to my MPS capability to undertake this type of research. This research can be done in the MPS. It's not necessarily easy to undertake, but like any force that's sat here being represented today, it can be done. You just need to find the right individual that can extract the data for you and ask them the right question. Which brings me on to the last two pieces. Are we asking the wrong questions? And I say that as a BCU commander who has previously asked, tell me where my knife crime is. I'm actually not really interested about where my knife crime is, because what I end up getting if I ask where my knife crime is, I end up with where my robberies are. Am I truly interested in my robberies? Well, I may be, but that's a different question. What I'm truly interested in is tell me where the people that are being serious and fatally injured are. And you need to start to get into that sort of distinction. The amount of presentations that I've had provided to me over the time where people have presented knife crime to me, but they're actually presenting weapon offences, off-weps. Again, you've really got to start to ask the right questions. And are we asking our analysts to do the right questions? Are our analysts being empowered to actually do some of this type of work as opposed to just putting dots on maps? Which in their own is okay if that's how you're going to target it, but could they do more? And then the final thing for me is around public debate. In policing, and when I look at what the Home Office have put out, we talk about knife crime as this big conglomerate of information. You see when you start to dig into it that there is so many variations and so many different patterns within knife crime that if you don't speak about the specific part of knife crime that you're interested in, you gloss over everything else. I could stand up here and say, don't worry too much about disproportionality of black victims because they only account for 23% of knife crime. But that would be wholly wrong if I don't then tell you that they account for 45% of those people that are serious and fatally injured. And we need to really think about when we're talking about in the public debate how we are representing the figures. Have we truly represented the figures in terms of the specific piece of knife crime that is of interest to the public? Because from what I'm seeing, the interest of the public, and certainly what's being played out in the media, is not the person that turns up in the park and is asked for their mobile phone, and at the time of being asked for their mobile phone, they say, I've got a knife in my pocket, they've never seen a knife. That goes down as a knife crime. What they're truly interested in, and don't get me wrong, I'm not belittling that as a crime, I'm just saying in terms of knife crime, what they're really interested in is the 15-year-old that I had stabbed in the middle of Woolwich last week. That's where we need to get to.
Good afternoon, everybody. As ever, it gives me great pleasure to introduce Rachel Tuffin. Rachel is the Director of Knowledge, Research and Education at the College of Policing. For those people who may not be so familiar with the College of Policing, that is the professional body for England and Wales. And whilst people in England and Wales will know that, some of our colleagues internationally will not necessarily know that. Their role is to do three core things. Firstly, to support the professional development of police officers and staff. Secondly, to set standards for police forces. And thirdly, and really importantly in the context of today, is making sure that evidence-based practice is related into what we do day in, day out, in ensuring that we protect the public better and we secure their trust and their confidence. Before the College of Policing, Rachel has led teams, research teams in both the MPIA, now defunct, sorry Peter, and the Home Office. In 2013, she was awarded with an OBE for services to policing, and particularly for her contribution to evidence-based policing. Today's focus is going to be a stock take on the role of the College of Policing, where it's got to, particularly in relation to the shared mission of delivering that evidence into practice, which is what we're here for today. And a particular reference to serious crime reduction. Rachel.
Thank you very much. Good afternoon, everybody. It's a real pleasure and a privilege to be here again. I do this sort of every year, except for last year, of course. And I think hopefully it will build a bit of a bridge between what you've been doing this morning and what you're going to go on to hear about from the senior officers in a minute. Because I've got my head in two places. On the one hand, trying to think about how can we help with the communication and the sort of interest around evidence-based practice for officers on the front line, on the ground. How do we make it kind of sexy, if you like? And then at the top end, how do we think about organisationally how we make evidence-based practice normal and embedded and mainstreamed and invisible? So those two things are really what we're trying to do and what we're trying to join up. So I'm going to do that around that theme of serious crime reduction, as that's where you're focused. And in terms of sort of definitionally, a lot of what I'm going to talk about is around serious violence, because that's where the ministerial focus is at the moment, of course. But I'll also touch on some other little bits, sort of a little bit around CSE, tiny bit on modern slavery, but mostly around the sort of the theme of serious violence. Suzette mentioned it. This is what we're sort of there to do. We've got these three chunks around knowledge, standards and learning, and the knowledge bit is our foundation, if you like. That's kind of where we start from. It's really core to us as an organisation that knowledge is evidence-based, and that was really quite a fundamental shift from where we were before. We had a lot of kind of knowledge being shared that didn't have an evidence base. So, you know, we've moved on incredibly, and if you think about that as a kind of stock take for us of where we've been over the last 10 years, I always try and think long game, when sometimes I feel as some of you out there kind of trying to do difficult projects like colleagues have spoken about, feel like you're trying to push very heavy things uphill. You think, okay, long game. Come a long way in 10 years, we'll be a long way further forward in 10 years. And that foundation, that knowledge is building all the time. So the knowledge side, and I'll say a bit about the What Works toolkit on that in a minute, then feeding that into standards, so making sure that knowledge base is actually in all of our guidance, the standards that we set, and ideally where other people are setting standards, interfering to make sure that that's got a knowledge base too. And then ideally, and this is the real trick, and that's what you don't just symbolise, you do it here in this room, is in the learning and development, it's not just about helping people to develop new skills and knowledge, but it's actually about how that then drives our professional knowledge base, which then drives the standards, and all the way around in a beautiful loop. And I think that's what's so important about what you're doing on this programme. I mean, there are others, but this one is very fundamental, I think, to developments in evidence-based practice. So, a little bit on the toolkit. Give me a wave if you've looked at the toolkit. Oh, yeah, okay. Might have expected all of the hands to go up, but yeah, it was pretty good. So the numbers are going up a lot on the toolkit view. So the toolkit is basically what you might call the top end of what we've got in terms of being evidence-based, because it's a summary of all of the evidence where we've got multiple trials on specific interventions. They're reviewed, what's called a systematic review. Many of you will know what that is, combining the results of several trials to get an overall effect, and then putting that onto the toolkit. So you have to have plenty of trials on the same thing and then you have to be able to summarise that evidence and get it onto the toolkit. So it's kind of your top end. But it summarises all of that. What the items that are up there are selected on violence and young people. It was mentioned over dinner, if actually the other day, the CBT, cognitive behavioural therapy, being very important. And if you were thinking about what other elements might be things that you would want to be happening around you, what your partners would be doing, what questions you might have about what they're doing, some of the elements that you can see on the toolkit are not police-led, but it's very interesting to think about whether they're actually being done at all by partners. So things like therapeutic foster care is an interesting example. So we talked about targeting a lot already. How targeted is the work on, you know, what happens in social care, for example? It's asking questions about things like that. How well targeted is the work going on around you as well as the work that you're doing? We think the views of the toolkit have gone up massively. We think that's connected to our police constable degree apprenticeship. So that's a change in our curriculum in England and Wales, where we've increased the level of the curriculum to allow it to cover evidence-based practice and vulnerability and a whole load of things that weren't in it before. And that's now tying in to the toolkit. So as students are doing that work, they're all going on and viewing the toolkit. And that's a massive difference, because what used to happen is we get people coming onto the strategic command course at the other end, and it was the first time they'd done anything on crime reduction. So it's now what they'll do when they first start in policing, and I think that's really encouraging. You know, something that we can be pleased about. Or when we won an award, but it's only silver. Oh well. So one of the other things that we do in terms of trying to get the knowledge base in people's hands, and this is the sort of bit about trying to get it to people who've actually got to use it, lots of different briefing examples. So there's a knife crime one. We've just finished one on county lines, which we'll be sharing soon. The one about what's the best thing the police can do to reduce crime is focused very specifically on PCCs as an audience, because it tries to make sure those core messages for new PCCs are really clear about what the police can do well based on the evidence base. Just finished a problem-solving guide as well for knife crime tactics. So we've got some good feedback from the practitioner analyst who's reviewed that, says, yeah, it's really good, you need to get it out there as quick as you can. So that will be coming out shortly. The thing I thought I'd pick out a little bit was the disruption tactics. We need to refresh it. I went and had a quick check of it earlier, and it's some of the things in it need updating. But the orange boxes there, they're all things that you could use to disrupt. And I was thinking about it as a, you know, different ways that you can just make life difficult for offenders. It's a really interesting catalogue of all of those, and you might fit them in with other interventions, but there are all sorts of behavioural ideas in there. Things that are a little bit perhaps left field, or things that you might not always use. So one of the ones in there is about targeting accountants. So the people that are working with the people that you've got the issues with, and using their professional body to get them investigated and get them the equivalent of disbarred and fined. So it's kind of finding all of those little creative routes to get at the people you need to stop. So that's there, needs a bit of an update, but is still, I think, a helpful resource. So that was the knowledge. We then put that into the evidence-based guidelines, and increasingly we're using this as a sort of standard model. If you've heard of NICE, the National Institute of Health and, actually now, Clinical and Care Excellence, I think they are. They use this model of bringing together the evidence base, and they do a review of the evidence, and then they bring in practitioners and experts together on a guideline committee to have a real sort of going over of the evidence. What does this then mean for what we should be recommending for practice? So we've taken that model, there's a few examples there, but the new one we've just finished on risk kind of can be summarised in 3 words really: clues, communication and curiosity. Somebody who one of my colleagues described as a bit grumpy and not too impressed with what we do generally, picked it up and went, it's quite useful. Put it down again. That's going to come out soon. But again, it embodies this idea where you use the evidence and then you bring in practitioners' ideas. So clues, communication, curiosity, that comes from the practitioners. And it makes sure that an evidence-based approach is communicated in a way that makes sense to the front line. And I'm sure you all have experience of trying to do that. A lot of it around storytelling and the case studies you use, and we've heard a lot of really good stories that can help with that. So that's the sort of evidence-based guidelines, the building it into the standards bit. And then I thought I'd pick out on learning and development. I mean, some of you will know we've got lots of different areas in learning and development, specialist and niche stuff that happens out of Wrighton, so that's covert and some of those areas. But what I thought I'd pick out, obviously, are the ones that are more relevant to serious violence. We've been doing more knowledge sharing events, so we did lots of these during COVID, really fast time. It's much easier to do, of course, online, and it's really helpful because the minister gets a bit impatient. He was speaking this morning, gets a bit impatient with the sort of, you know, well, we keep saying the same things about what works. It's like, yeah, but there must be new things. What new things are people doing, and how can we find out about those? So these knowledge sharing events are great. It's, you know, not fancy at all. It's what you'd expect. People coming together online, describing what their initiative is, what problems they've had with it, where they've got to, whether they've got any evidence around it working yet, and people able then to use that, even though, you know, it's not clear yet, it's not proven, it's not evaluated, but they're sharing ideas and thinking about whether they could adapt it in their own area. The interesting one, the predictive tools one, was fascinating because what came out of that really is we're still quite a long way off, as you can see, I think through the analysis that's being presented, of being able to be truly predictive. Some really good stuff about risk and generating lists, as Alex was saying, but in terms of being able to target it for interventions purposes, a bit more difficult. And although people had thought there was quite a lot of interesting artificial intelligence work going on, turns out there isn't really. It's not as, you know, we're not as far forward as we think. So, but that's quite good because we've got some scope to build in some underpinning around ethics and so forth. So, but some really good stuff coming out of that. I'll say a bit more about one of the examples. I don't think I'm stealing anybody's thunder. But I'll say a tiny bit about that, just in case they're talking about it tomorrow. Second bit, the Minister mentioned this, so we're going to do a sort of toolkit and a hotspots academy, so to help forces actually implement, exactly in the way that Essex and Bedfordshire were talking about earlier. Obviously, the critical bit is these things you can read about it in a study or hear somebody present it on this stage. When you try and do it yourself, there are so many things that you've got to get through. I mean, all the issues about data that people have talked about, then how to actually do the analysis, how to get it in a form that the officers can use, how to persuade the officers that this is a really good idea, how to do all the implementation. Anyway, sorry, I won't go on, but you get it. So that academy will be sort of a combination of direct support and inputs from relevant academics and people to help them. So hopefully, if that model works well, because it's the first time we've tried something quite like that, we'll be able to do it for other types of intervention as well. And it fits with the other thing that the Minister gets excited about, which is that why don't we all do something if it looks as if it's working in one area? They kind of leap up and down a bit inside the Home Office about consistency. And we can explain, of course, that it doesn't always make sense that you use the same intervention in different forces for all the reasons that you know, but if there is something where it looks as if it could really make a big difference, it's how do we help the other forces to do it if they haven't got maybe the analytical firepower, or they haven't got a really easy to access data system, or whatever is the problem for them. And then the last bit is the bursaries. Similar to what happens here on the programme, it's the recognition and impact that's really starting to spread a little bit. That's just a quote from a DC that emailed me a few months ago. It was just a lovely email to get out of the blue. And I think he was feeling pretty disenchanted, you know, sort of lacking in motivation, and now he's just full of beans. And I think it's a bit that thing about, I mean, he's a DC, but we've also had PCs feeding back and staff. If you feel a bit stuck and you don't want to go up the promotional ladder, the recognition that study and publication can give you, I think is actually quite powerful. Just let me press the right button. And we've introduced it's kind of a magazine really, rather than a journal, to try and help with that. So to offer opportunities for people to get recognition, to get read, to get referenced, and for other people to learn from their interesting examples. It's based on, give me a wave if you've read the Thames Valley Police Journal. Yes, very good. So that's set up by somebody called Katie Barrow-Grint. and it's just for Thames Valley, but it publishes, she kind of had this realisation, there were all these people studying in force, and nobody really knew what they were doing, or were using the findings of the research that they were doing. So she had the idea of setting up a journal to draw all of that together, and also for people to peer review each other's articles. So they're building up sort of critical analysis and writing skills, peer reviewing each other's pieces as well. What I really liked about it, for any of you who've done an academic article yourself, peer review, it's not really very helpful. It's not intended to be helpful. It's intended to be critical. Whereas with her model, it is, sorry, that's a bit unfair, but you know what I mean. Her model, it's very much about support. So it's about helping the person to get over the line with their published piece and to actually get it in a form where it can be published. I had an email forwarded to me from a colleague that a TSU inspector in the Met said it was all right and he might consider writing for it. So we're like, yay! Because sometimes we're kind of seen as a bit disconnected. So trying to get that sense of connection, I think, with this sort of thing is a good way for us to do it. We made a deliberate decision for it not to be all research. So Katie's piece, I think, is almost all research, maybe the odd book review here and there. We decided we needed to be more open and have a bigger set of article types. So we've got all sorts of things in there. You can write just a quick idea. If you've got an idea, you can share it with us. We could put that in. There are book reviews as well. There are little practice notes, and then there are long reads based on people's full research projects that we publish as well. And again, I think that sort of recognition, people having a place to show what they've done, again, is a good organisational lever and something you could consider if you don't have your own one in force, but also very welcome to submit it to our Going Equipped. So then the other things, we've got programmes of work to help build the evidence base. I'll summarise all of this by saying I've got some seminars running this month. Please do join us for the seminars if you just Google that, so Vulnerability and Violent Crime Programme. You put seminar in the end or college and it'll pop up. I think 2 of them might have gone, but the other 2 are still to come. And these were a very bottom-up kind of approach to evaluation. So there are all sorts of risks with that, which I'll say a bit about. But essentially what we did was with National Police Chiefs Council, we went out and said, tell us if you're doing something interesting in violence or vulnerability and you're not evaluating it and you don't know how to evaluate it, and we'll engage with you and have a chat. So we had loads come in. We sifted them out and down to the ones where there was a reasonable sort of idea of a logic model, a sort of problem to mechanism to impact, and where it was clear that we probably could help them and put an evaluation in place. Funded those evaluations, so they were done by, I think it was Birmingham and National Centre for Social Research. And the people who ran those interventions will present at these seminars with the academics. So they're quite early days, a lot of them, because it's an example initiative. But usually pilots, there's usually some limited data around impact on reoffending because the time period was quite short. But what I really love about the reports is they're really, really clear about the connection between the problem they were trying to solve, what the mechanism is, what the impact measures were. So it's a nice little, each one is a sort of little object lesson in really thinking about targeting, mechanism and impact. And if only for that, I think they're worth reading. But there are also some really interesting emerging findings from those projects as well. So again, nice sort of collaborative piece. And then this is quite nice. We don't do this sort of stuff very often inside the college. Usually we're just supporting others to do it. But this was a particular opportunity working with a knife crime lead. I think we commissioned this from an external academic. But just to do something a bit experimental, we were looking around really for ideas about how we can help with knife crime. So this was using, we were trying to avoid, I don't know where the Met colleagues are now, we were trying to avoid the issues of getting access to data from the Met because of the speed that this had to be done at. So we were actually using open source, so pictures of knives from Twitter we used for this. So I think it was seized, and I analysed which ones were being used. Now I'm just going to check very quickly because I don't want to make a mistake on this. Let me just scroll down. So, they were analysed, the knives used in fatal and non-fatal violence, and it showed that the attractiveness of some of the knives can outweigh both how difficult they are to get hold of and how problematic it would be if you were stopped with them. So the size of the dot here shows how often a particular type of knife featured in the violence, and then the length of the line, how frequently they're used in the same incident. So it's sort of a picture of group violence, is the thickness of the lines. But anyway, bottom line is you can see that you get one manufacturer popping up in quite a lot of the cases. It's what we usually see in all sorts of analysis, isn't it? And specialist knives are a serious problem. So it gives you a bit of targeting opportunity. It's like any way in, really, isn't it? And I think there are lots of, if we could generate more places and opportunities for people to use our data to analyse it, I think we would be in a good place. And I've been talking to Dave Shaw, who's one of your supervisors, about some ways that we might be able to do a bit more of that. And if people have got ideas about that, I'd be really, really interested in terms of sort of, you know, how we can build more opportunities to use data in sort of odd ways or interesting ways to find new insights. So then we're on the collaboration territory. So moving out a little bit from policing, colleague just mentioned public health. We're doing lots and lots of work with Public Health England and with National Police Chiefs Council on how to embed the public health stuff, so how to really get it into the system again. It can be a bit dry sometimes, some of it, because, you know, you're having consensuses and, you know, developing framework documents and so forth. But we're gradually getting into the territory where it's kind of taking off. We're getting more and more case study examples. You can see a few of them there. One from West Mercia, which is sort of classic stuff around warning letters and support for families. Lancashire doing their trauma-informed learning, and Devon and Cornwall with their sort of whole family behaviour change programme. But I think you could argue in some ways that it's quite a lot like problem-solving approaches, you know, that it's quite familiar to us. But it's, your colleague earlier was mentioning, you know, there's got this flavour of how do we just remove it from the system, and also it's got this whole population epidemiological kind of idea. So treating it as a contagion and thinking about it, and just that in terms of a thought experiment, I think can be quite helpful. There's a hub for this and a network, so if you're interested in public health approaches in particular, there's on the Knowledge Hub, there's a specific hub that's for leads who want to work on public health approaches, who are sharing their ideas and the ways that they've overcome particular kinds of problem. And there's some great events, so 4 Nations events that have been running conferences, and I think some of that is also available online to see after the fact. Then we're working with our fellow What Works centres. There's a money bit in this bit, if you were just dozing off. All of our What Works centres tend to come up with the same things in some areas, no matter what the outcome. And we need to do more on this, because if you look at the Education Endowment Foundation one, they've got good outcome for academic achievements, some around social and emotional learning. Early Intervention Foundation focus on some of the wider risks, health risks and other risks. We obviously focus on crime. The YEF focus on serious crime for young people, specifically the Youth Endowment Foundation. We're all saying social skills training. So is it being done? Is it being done by all schools? Can everybody access it? Is it embedded? We keep asking the question. We don't necessarily get terribly satisfactory answers. So I think that's another one where your questioning as police leaders is also really helpful. Every time you ask the question about this, is it happening? Are schools doing it? Is it embedded in the curriculum? Because it's not just our risks, it's also teenage pregnancy and drug and alcohol misuse. So, you know, can help in all of those areas. Money I mentioned. If you haven't had a look, worth going and have a look on if you've got any responsibility for serious violence, and particularly for serious violence involving young people. I mean, mostly you would have that automatically. Youth Endowment Fund have got programmes of grant funding, and it's also all evidence-based. So that you can go in there and look at what kind of rounds of funding they've got running. They've got some on, which is sort of already themed, but they've also got some if you've got a new idea and you want to do some early piloting or some really early work, like the ones I was talking about earlier. So we're not ready to do kind of full-on trials, but maybe some exploratory work which could help to establish ground for a trial. So worth having a look if you haven't done already with one of our colleagues there. And then we're sort of also trying to embed the evidence base in all of the things that we do across the system. So with violence against women and girls, obviously it's come up to the top of the agenda again. We're working with MPCC on an evidence-based outcome framework for our work on strategy. So how do we make sure that what we do is actually evidence-linked to the outcomes we're trying to achieve? And I'll say a bit more about what we base that on in a second. Again, the knowledge sharing of X, the bit I was going to hope not stealing anybody's thunder, but Kent, from Kent, many of you will know him, who's working in Kent and from here originally, from Cambridge, is doing some fascinating work around using A&E data and police data and showing, this is in domestic abuse, where it wasn't obvious to police at all, some of the people who then went on to be, these are lethal or near lethal incidents. So I think it's broadly something like roughly in quarters. So a quarter the police knew about and A&E Health didn't, a quarter the other way round, a quarter both knew and a quarter neither knew. So when you're thinking about, you know, how to prevent and how to target, that sort of information is really important. But it took them 2.5 years to get access to the data. But if it's been done once, it could be done again. And then final thing here was just on DARA. So we've got a new risk assessment, and that's one of our big programs. So the other thing we do, if there's something real big shift that needs to happen, and lots of questions have been asked about the evidence base for DASH, and we wanted to move on with a sort of formally evidence-based risk assessment. So we did the evidence review, we did a pilot, and we're now on the cusp of rolling out the new risk assessment. And what's important about that is it focuses on being able to identify coercive control, which, as I was just saying with Kent's example from Kent, is hugely important if you're wanting your frontline officers to clock things that maybe there's no violence, but there might be something else going on. This is the outcome framework we developed for the RACE programme, and we're basing the violence against women and girls on that. So I just wanted to mention that. And finally, the future here, if I can see Suzette standing up, get on with it, woman. Finally, looking ahead to the future, the reason why obviously some of that race and inclusion work matters so much is because some of the things we're seeing in our futures analysis are sending signals about just how much work we've got to do if we're going to keep ahead of the sort of crime trends and issues, the community confidence issues that we might have. So changing our approach to community engagement, and there's some really interesting public health and reconciliation approaches to consider there, could be really important to us in the future. And that's me done, Suzette.
Have you finished, Rachel?
I have finished.
Excellent. Most of you will have heard the terms drains and radiators. There are drains, people that drain the life out of you, and there are radiators who are enthusiastic, positive, engaging, and all the things that we've just seen and heard from Rachel. I suppose I am going to give you the opportunity to have one question before coffee, but I'm going to give Rachel the opportunity to say, bearing in mind this is Block A, and people will be thinking over the next 12 months about theses, if there was one area that you from the college could identify that might help people focus on what would be a really positive step forward in evidence over the next couple of years, that'd be really helpful.
Yeah, so I think that the area where we've got the biggest gaps and the most worry is actually in criminal justice outcome improvement, actually. It's how to improve outcomes in criminal justice.
If you've not looked at the What Works Centre, it's really worth looking at. There is a huge amount of material on there. It's divided up into the different areas of the country, so the different forces, but it also allows you to apply filters in terms of the areas that you're interested in, and allows you to do a top sheet, exec summary, right through to the detailed research, and well worth a look.
I'm delighted to say that we have questions from the remote audience, which incidentally includes Little Hall, just across the way, which has another 35 people socially distanced. The first question is one I'm very happy to answer. It was about the session on Essex and Bedfordshire's hotspots experiments. from Tom Andrews, are the results of Operation Rowan and Operation ARC available publicly or in journals anywhere to share with policing students? The answer to that question is almost, because both papers will appear in the, let's get this straight, the Cambridge Journal of Evidence-Based Policing, which has put both studies into production, and when the Cambridge Journal for Evidence-Based Policing puts them into the online first category, you will be able to find them at that website for Springer Nature. All you have to do is put in Cambridge Journal EBP, and you'll get to the journal, and then you can look for the studies, which we expect to be out within the next 2 to 3 weeks. Shouldn't be too long. And we're also in discussions with officials at the Home Office about whether they will comment on the findings and help to draw attention to some of the important implications that the study may have. Further to that particular session, I have a question about the baseline period for the targeting, and it's actually from a current MST student, but I think it goes to what Rachel Tuffin was saying about the nuts and bolts of doing hotspots policing. And so this is a very nuts and bolty question that I'm going to ask both Matt and Lewis and Michelle, if you'd like to comment on. And the question is this: how long a time period did you use to create the baseline data for identifying the hotspots? And I want to preface their answers to that question with the finding that we teach in the master's program, which is based on the 8-year analysis, or it's 12-year analysis of Birmingham data that Constable Weinborn did for his Ph.D., in which he found that from year 1 to year 2, 75% of the places that were hotspots based on counts of crime in year 1 were still hot in year 2, and by year 3, 66% of them were still hot. So it's a very slow turnover, if you will, or replacement of the places that were identified as the highest crime locations in any one year, with roughly in the vicinity of 5% of the street segments in his study producing 50% of the crime. And then to do that for harm, he found similar results. So even though Leicestershire showed harm spots and hotspots aren't necessarily the same places, what we think from the evidence we've seen is that there's much more persistence in place crime than there is in high serious offender crime, possibly because the offenders get caught and go away to prison. That's possibly a good thing. But it means that you can't constantly target the same people from year to year, but from one year to the next, you can certainly target the same hotspots with pretty high levels of efficiency. That's the state of the literature. Now, knowing that, as our scholars did, let me just ask Lewis. Where's Lewis? Right here. Lewis, what was the time period that you used to identify the 150 by 150 meter hotspots in Southend-on-Sea?
So we used a year's data prior to the lockdown. So we ran it up to about the 20th of March of 2020, and we did actually look back. We looked back at 2 and 3 years to actually see if there would be a change, and it was pretty much exactly as I mentioned. There was a distinct change on about 30% of them, but that was it. And so we used the 12 months data, and we knew that a high proportionality of that were still hot going into that year.
Okay, so I'm going to ask Michelle if you or Matt would like to take that one. Would you like to take the mic?
I'd like to see what Michelle's going to say. We took about 20 months data. We would have gone back further if we could, but Bedfordshire changed its IT system. These are the sort of practicalities you have to deal with all the time. But we did it in a way that kind of replicated the Constable Weinborn work, in that we split it up into months, and we looked at what the hotspots were in each of those months that we had, and then we just looked at which ones were most consistently appearing at the top of the list. We selected the top 21 of those, and that's what we proceeded with. But we were trying to build a system that you would refresh on an ongoing basis if you were doing this as daily business.
There is this question of what statistical model did we use to determine the significance of the results and on what baseline level of expected crime. I think a number of us can take a stab at that. I'd like to suggest, first of all, there's a difference between a model and a fact. A model does a lot of things. Basically starts with the words, if we assume, and it takes it from there. That's why there's so many different models of how many people are going to be infected 4 weeks from next Monday when we change the rules. They're predictions. But actually, the logic of a randomized experiment is not to make a prediction per se. You can make a hypothesis, but we're trying to compare doing two different things to similar kinds of places and then to actually observe the difference between the two. So that's not a model. I think it's fair to say that's a finding, a comparison, not unlike how you heard from Beds and Trevor in their analysis of individuals, which wasn't experimental, but I don't know, I don't think we'd want to call it a model as much as in some cases conditional probability. That is, if you're part of this group, what are your odds of becoming injured or killed in knife crime? And if you're part of that group, are the odds lower or higher? Again, that's not a model. That's the part of arithmetic that I actually understood when I was 10 years old. It's fraction, and I haven't learned anything since. But I think if you really understand fractions, and you can really get behind denominators, that's what makes evidence-based policing work. And we just have to get the right denominators. And of course, measure the numerators the same way as well as the denominators. And I think maybe I could ask Chief Constable Vaughan to just restate what you said this morning about numerators and denominators. What's the difference between the numerator in the calculation of disparity in stop and search in Dorset and the denominator? What's the difference between the numerator and the denominator that you were talking about so eloquently this morning? I think it was. Okay, let me ask you this. Where are the people who are stopped from?
Right, okay, so 20% of the people that we stop and search in Dorset are from outside of Dorset, predominantly from London, and of those, 61% of those are from black demographics.
Right, but 20% of them are from outside of London. That's the numerator. Okay, what percentage of the denominator are from outside of London?
61.
No, of the denominator.
I don't know, sorry.
Okay, they're all residents, which means zero. Zero. Nobody from the denominator is from outside of London. What are all those people in the numerator doing there when they're from outside London? Okay, this is a wonderful thing that I think we can clarify, and we do this at Cambridge a lot when we say, you know, how does this concept apply? And what are the exact facts in this interpretation? And I've been struck since the beginning of the discussion with Dorset about this mismatch of numerator and denominator, which appears to be standard operating procedure in calculating these statistics all over the country. And, you know, the only place where it's valid is the nation as a whole. ONS says this is the number of white people in the nation, this is the number of white people stopped. That's the only one in which the numerator and the denominator are matched. Go to any other locality and you got people coming in from outside or going out, and either way, it's a mismatch of the numerator and the denominator. So the key thing in these experiments is to make sure that we have the numerator and denominator linked up, and if we only have 720 days in which there's a foot patrol in Southend, and 1,080 days in which there isn't, spread across the hotspots, we have to divide the total harm by, in one case, 720, and in the other case, the 1,080. So if you read that article, pay very close attention to how important that is, and it's essential when you're adjusting for operational exigencies that you have to have fewer actually delivered cases than control cases. Then getting that denominator right for that numerator is absolutely essential. So I'd like to say third grade, but that's what it is in the United States. I don't know what age you can learn numerators and denominators in this country, but that's really where we got to go to conceptually. So what about this question from the commander of the BCU in London West, Peter Gardner, which was directed at the minister, who is not here. Anybody here want to speak for the minister? What he asks is, can we have any comments on the current challenges in CPS and the more pertinently, the court delays at the moment and the impact on prosecution as a deterrence measure? Who wants to grab that one? That doesn't even depend on numerators and denominators. It just, all right.
I'm not sure that I ever did enumerators or denominators, and I'm glad that it's you that's sitting out there that will be doing this stuff, and looking at us not being able to do it will give you hope for the future. So the impact, as we heard yesterday from Martin, will be huge. And it's not just in terms of the criminal justice system, but all the reviews that are done. So domestic homicide reviews, 3-4 years behind. So in terms of learning and understanding, then again, impact on trust, confidence and legitimacy will potentially be huge. We know about Crown courts, magistrates courts, again, huge tail. Impact on victims, significant. Some of the vulnerability issues will become even more difficult because those victims are even less likely to want to go to court. So I don't think it's been quantified, but huge.
Right. Just add an example. So maybe there are some possibilities in terms of fast tracking. It's always kind of a bit contentious, some things getting ahead of other things. But to mention Katie Barrow-Grint again, actually, she's been doing some really interesting work in Thames Valley about getting domestic abuse cases fast-tracked to judgment, so that in some cases they've had people go through where the victim's bruises are still visible. And that's meaning, obviously, that they're more likely to be able to keep the victim in the process. So you can't do it with all offences, and obviously if you're fast-tracking some, then some others are going to wait. But it could be that there are certain categories of crimes where it's worth doing that, because if they fall out of the process, they're gone for good, of course. And in the case of domestic abuse victims and probably other rape and sexual assault victims, it might be that it's in those areas where it's the most important.
I'm going to ask Sir Dennis O'Connor to answer another question for the Minister. And the question is this, from Jonathan Tutman. Minister, is it in your gift to ensure that data-driven, evidence-based policy and practice is embedded in the Home Office policing plan? Is it in your gift? Now, there's an interesting question.
It's in the Minister's gift to put something in a plan. It's not in the Minister's gift to deliver the product. That's the answer.
What can be put in the category of the Minister's gift that could enhance the ability of chief constables to deliver the product?
It's too tempting, this, really, but I think Kit Malthouse is a potential character who might be able to do it, but it would take an acknowledgement of overload in the system. We just heard of one symptom of it. Basically, we've had a process over a number of years trying to be more sophisticated about dealing with particular victims and particular problems, and we've upgraded promises and standards, and the system is gradually getting sclerotic as a result of it. The sclerosis is more and more evident. What has become more problematic is what is a true priority. I do think there's probably a convergence to do with violence as an absolute priority. But I think it requires some kind of restructuring of the landscape so you do not end up in a bidding war about what's important, where, something happens, we have a review, we have an accumulation of recommendations which just cannot be done. And if we truly want to intercept problems, then the essence of leadership in the end is a willingness to say no, or we do less of this in order to try and attack a problem, particularly like this wave of violence which seems to come and go, but is certainly running through us now. But that needs political cover. That's the essence of why you have politicians in the end to try and come forward with a compromise that's sensible. The problem we seem to have is not finding a politician necessarily willing to make the hard choice. We expect you guys to make the hard choice, and we're trying to give you hot tips on how to do it through, a fair weighting system for what happens. But what we don't have is a fair weighting system for what we want to have at government level and across all of the other agencies, the inspectorate, the interest groups, about what actually we want to focus on and tackle, as it were, in sequence, obviously, which things come first. And I think at some point, somebody with a lot of courage could do that, good look on that kit, and take that forward.
I have a question, though. When you say a fair weighting system, could you spell that, please?
Well, some might call that a harm index, or if you prefer, a severity index. The only footnote I would put on that is this, that if you have that and nothing else, then I think you potentially have a problem, which I discussed with Trevor earlier on, and that's the problem of relevance to an awful lot of people who vote and people who care about things that go wrong. So I think you have to have a tempered version of harm or severity where you do acknowledge that people have problems that they still want some attention to outside of the worst things that happen in life. Because that way you retain relevance to them and some kind of bond and a degree of trust. If you sever it completely and just you vacate the space, you lose the trust and you lose the support. And PCCs and politicians then don't get elected.
I'd like to ask the two serving chief officers their view, if I may, on this question of what could a Home Minister do that would really help for chief officers juggling all these priorities?
Now, I know I'm retiring in October, but I don't want to get fired before I get there, so I'll be cautious with my language. I think there is a temptation in government at the moment to be popularist and to be responsive rather than to be thoughtful and bringing about sustainable early intervention policy. So, and I think that's a problem. We've seen it with the Criminal Justice Task Force. I won't talk out of school, but I've had some struggles convincing certain people in government of what would work around digital forensics rather than what had been briefed into senior secretaries of state that might feel popularist. So I think that's one tension. I was regaling my friends and colleagues in the pub with a story this week around the legitimacy of policing around COVID. And if you recall, right in the heart of the second lockdown, Martin Hewitt and Priti Patel did the 5 o'clock briefing. And we'd agreed as chiefs that we would need to take a tougher stance on enforcement because things were getting really serious. We were losing 2,000 people a day. And that was the national message that came out on the 5 o'clock briefing. I was on a call with my 8 parliamentarians and 2 leaders of the council the following night, testing the water in a democratic society, testing the water with my political leaders around how Dorset Police be best placed to continue with our enforcement. Their view was, forget what they're saying in government, we like the proportionate approach that's been used in Dorset throughout the pandemic, so we don't want tougher action, actually. The Police and Crime Commissioner surveyed the public, and 75% of the public said they wanted more action, and 55% wanted zero tolerance. And that's the tension between what the Police Chiefs Council decide is a sensible approach, what government and ministers want, what local parliamentarians want, and what the public actually want. And I think that's, at the moment, we seem to be, it feels a bit like push me, pull you around policy because of those tensions. Hopefully that doesn't get me the sack.
Fingers crossed. I'm going to ask Assistant Chief Constable Jackie Sebire from Bedfordshire what your view on that would be.
So I'm going to actually spin it the other way and be slightly more positive, actually, because I've got longer to go. So, but also, I think when we're looking at serious violence, in 2018, we were called to the Home Office, and you know what it's like. You have to get prepared, and you think of every flowchart, every question, every bit of data that you can think of, and they always find a question that you hadn't prepared for. However, we were having the discussion about what we were going to do, and it was all very much enforcement and grip and surge and all of those forceful words. And then we just mentioned, I don't know if Sarah's still here, but we said, what actually about engagement, reduction, prevention, violence reduction units? And from that conversation, actually, to his credit, the Home Secretary at the time stopped and took that on board. So I think there is something about being productive and providing the evidence that actually you need a dual approach. However, I think, so that's a positive, but I think the other issue is, and Mr. Malthouse did it today, when you spoke about IOM and prisons, oh, that's not my job, that's not in my remit. And that's where we have all these problems. These are multi-dimensional problems, but the Home Office and policing seems to have to manage most of it.
Well, thanks very much, Jackie. And David Shaw, fairly recently a chief officer, but still working with the Home Office, so full declarations of interest.
Yeah, thank you. My point isn't so much maybe about what we need government to tell us to do. And when I say yes, I'm no longer us, but forgive me for using that term. They have a difficult task as well, because agendas change, what the public wants changes. And I want to take you back a little bit to the first time I was semi-senior management, when I was a superintendent and a chief inspector in Birmingham, during Blair's government. And they were pretty clear. It was about volume crime. It was car crime, and it was robbery, it was theft from a person, etc., and it was burglary. And I remember a very, very good friend of mine, who's still a very good friend of mine, who's in child protection at the time, saying, you're missing the point here. There are people getting very, very badly damaged, and all you see on your force performance sheets are burglary hotspots, robbery hotspots. And I wasn't really listening, because it made it the government was clear to me what they wanted, force leadership team, and we were a force that was coming from a period of, we'd been pretty average, and we were starting to become a really good force. So I was very much enamoured with what was being done and what we were being asked to do. And I think, yes, I'd agree with all the points that we've just been made about the complexity of policing, but maybe there's also a little bit that we have to do, or leaders have to do, which is also try and sometimes help the politicians get their head above the parapet and just saying these threats are emerging. And I'm not saying you don't do it, but the clamour sometimes to say, government, tell us what you want, just give us a set of defined priorities and we'll deliver. The danger is that message can become too simplistic. And I'm not saying for a minute, James, or anybody else, you're saying, oh, it's simple, you just want 3 or 4 priorities. But sometimes our job as well is to listen to the noise as well, and the other things that are going out there. Because if I go right back to my days as a PC, where we had some children's homes, and all I used to do was find the MISPA and take them back. I now know, looking back, that's where they were being abused. So maybe that might explain why sometimes they were quite difficult to handle. So PC, Chief Inspector, Superintendent, and now as a former Chief, looking back, we've got a job to do, not just to listen and to inverted commas, to be told what to do, but also sometimes to feed things in. And I'm sure there are lots of chiefs that do that through various functions, but that is also part of the dynamic.
Thank you. I want to come back to this theme with Sir Dennis in just a minute, but I'm going to ask Beds and Trevor if they can comment on another question from the online audience. And it's this: who is in the best position to use the targeting that each of you has developed? And is it just one kind of unit, or is there a multitude of locations within a big police service where that information could be used, perhaps in combination with intelligence and local knowledge, but where it's not being used at the moment because it's not available?
Yeah, that's a good question. So in my mind, when I did it, I was thinking about missing persons units. I was thinking about DS rank, DI rank, so very operational. But I think there is space for it sort of more strategically in terms of just determining what the priorities are and the level of resourcing that is available. So for me, I think the best people placed to use specifically what I've come up with, DSDI, but there is potential for it to be used more senior.
Yeah, I would say it's not the police. I would say it's actually violence reduction units and its multi-agency partners. Dealing with victims is different to dealing with offenders. Dealing with offenders, you've got some sort of, they're compelled to do something because they've generally got the sword of Damocles hanging over them, so you can get them to do certain things. I think when you deal with victims, it's completely different. And I think there's a lot of ethical questions around, what do you tell victims? How do you tell them? How do you educate them? Just a police officer turning them up and telling them that they're going to, that they're a greater chance of being a victim, I don't think it's going to work. So I think it needs a longer, sustained period of work that requires multi-agency input as opposed to policing.
Well, the minister mentioned a special predatory offenders unit this morning, which was made possible in part by the rising numbers, or the aim of rising numbers in policing. And in the first year MST program this week, we have group projects on what would you do with 100 new officers for proactive policing to try to drive down harm. But this goes back to this larger issue of why would you do that rather than dealing with vehicle crime or other high-volume, low-harm things. And I think it's in that vein that Sir Dennis would like to continue the conversation with another point, or am I wrong?
You're slightly off, Larry. You can usually read my mind, but I mean, one of the privileges of being in the inspector, of being chief inspector constabulary, is to watch people go to the Home Office to make a point or to turn up to answer questions. And one of the frustrations I certainly experienced over a period of years was watching the security service, watching other departments and the Treasury all turn up armed and ready to go. And the police service, without narrative, we had a strong narrative, didn't we, from Neil Basu today about, dealing with complexity and difficulty and recovering from things that go wrong. But also, we've heard some great examples of people within the police using data, analysis, and identifying potential solutions. And I certainly know what works in points of difficulty is if you have a police service that can turn up within some evidence prospects about what the issue is, what the problem is, and what you might do to focus yourself on it. You will guaranteed you will get people's attention. What you have to then kind of live with is that your role, whether you're a chief or not, Beds, it doesn't matter whether you're a chief or not in this context, if you've got something to offer, is that they may or may not do what you suggest, but what you have done is discharge your professional responsibility of giving them an evidence set of data, analysis, and proposals, because we are in a democracy. And at that point, choices have to be made about what's to be done. And I think what's happening over the years with the evidence-based approach is we're getting stronger about the potential of producing those proposals, whether it's Alex Murray, who you can blame if the spending review doesn't go to plan, or somebody like this. We have people now who can turn up with evidence and data and make a coherent argument which doesn't, as it were, seek to antagonize other people or other agencies, acknowledges their role, and said, this is what we can contribute. That is progress, Larry, I think, and I applaud it. what would be even better is if they can say which of those priorities they think they can tackle best.
So here's a question for both Lewis and Michelle with respect to what are you tackling when you're doing hotspots policing? Because what we heard this morning is a very clear priority of the government on serious violence. That's the title of this session. And yet we also heard evidence that if what you're concerned about is vehicle break-ins, vehicle thefts in high violence hotspots, is there really a trade-off between violence and property crime, or is it possible that you can actually get 2 or 3 or 4 for 1? Michelle, how do you read what you think you found in Bedfordshire? And I'm going to ask Lewis the same thing for Essex.
I think definitely you can get multiples. When you look at the hotspots and we sent them out, people knew where they were. They were obviously serious violence, but they were also ASB, there are criminal damage, there are crime hotspots. So that's the joy of hotspot policing, is the focus was on serious violence, but 100% by being out there, we reduced all crime, and hopefully, also Lewis touched on it, increasing public confidence. So it's a good thing because it will target a number of different priorities.
I think, as you said, really, clearly we focused, actually, really on that serious violence, because obviously that's where the funding came. But you're having that greater effect because you know where serious violence comes. You know you're going to get the convergence of other crimes. And actually, for me, we're targeting our most harmful, but having that deterrent effect on a wider crime type. So for me, hotspots actually delivers on everything. And as I said, the more exploring we want to do is where we start to unpick it, looking at your intelligence analysis around the problem profile, problem profiles for these hotspots, your problem places, your problem people that live around them, and actually getting more intrinsic around what we do with not just going and suppressing, but then the wider pop approach to it. And just probably while I've got hogged the mic is just go on to Sir Dennis's comment that the last probably 8 months, for me, I think Michelle's going to nod her head, has probably been the most surreal moment of my career to date, on the basis of, having a conversation with the policing minister, having surprise from Chief Officer Group when I've had that prior to briefing themselves, which I shall learn from, but actually the fact that they listened, and then having emails at a later date that then start to probe the questions of it, and then being able to actually find, a document that's then published by the Home Office referencing the work that's happened here. So certainly from my perspective, it's been an eye-opener, and obviously lessons learned.
Well, thank you for that. And could I offer this for a takeaway comment, and I invite anybody in the panel to object. It would be this, that rather than saying, as I often do, we need to set priorities, we can't do this and that at the same time, maybe what we should think about is a strategy for identifying police tactics that are more inclusive of both high-volume, low-harm crimes and low-volume, high-harm crimes, which would be more place-based than person-based. And it wouldn't do nearly as much for the very highest harm victims and offenders as I think we've seen with the work of Beds and Trevor. But it would be a way of resolving what voters often care about, arguably, and that's, what are you doing for my neighborhood? What are you doing for where I live? And if what we can stress is that a plan or an experiment even has this across-the-board effect of high harm, high volume reductions in the neighborhoods where we do this, it could lead to perhaps fewer days of 15-minute patrols, but again, under the democratic principle of everybody gets a little bit, which doesn't really work in medicine, but which may be something in politics. We could say that we're trying to evaluate tactics not only on the basis of their original logic model of the causal mechanism for driving down robbery, but all of the side benefits, much as Matt said this morning about taking vitamins to reduce your risk of disease, well, there's other benefits of, for example, vitamin D, one of which is to give you a better memory so you can study hard on all these complicated things that we work on here at Cambridge. Rachel, your comment.
Yeah, so just building on that, I think there is scope for having low-cost interventions that are much more general, and then that suppressing enough for you to be able to use your high-cost interventions on a much smaller number of people. So I mentioned that social skills training. The reason why I keep going on about it, and I do apologise, I think I've done it every year, but is because it has these multiple effects. It's the cheapest intervention there is in that territory if it's delivered in a classroom. So it's really cheap, it's got multiple benefits, but it has to be done in a school. So we can't really influence it. You know, you need education to influence that, but it is low cost. So it's finding the interventions where you say low cost for everybody, and then that leaves you just your power few or whatever, and those get a different kind of intervention, which is higher cost.
James.
Could I just, I'm a huge fan of hotspot policing, by the way. Alex's work and the presentations today, really, really impressive, and some great outcomes. But I just want to be a grumpy old chief, if you like, and just sort of put some caution around making this the sort of most hot topic in town. I saw the minister today thinking, I think I was reading his mind, thinking, actually all you need to do is 15 minutes at every hotspot and the whole problem of serious violence is fixed. Now, of course, we know that's not the truth. We know it's an effective tactic for public space violence, but there's far, far more resource required in more sort of hidden capabilities, to tackle all the work that Neil talked about, the impressive work of the counter-terrorism security services over the last 5 or 6 years. Very, very little of that was hotspot policing or visible policing. Most of the work that we do in our region around child sexual exploitation, domestic abuse, rape, none of that can be achieved through hotspots. And I think there's a risk that government might see hotspot policing as a cheap and quick win. I think it's effective and it's impressive and it's promising, but it's just one of a whole range of policing tactics, and we mustn't allow anybody to think that it's more simple than it is.
So one way to think about it is a balanced policing strategy in which we do something I don't think I've ever seen, which is crime reporting based on street visibility, which is the label that Lewis put on the South End on Sea, by defining a category of crimes, not with huge rigidity about what's street visible and what isn't, but I think actually if we refined that and thought about the things you can prevent with patrol because they're visible and the things you can't, I don't even have an estimate of how much harm is happening behind closed doors in a place like Thames Valley, where Jim Weems some years ago took a crack at this breakdown of the harm spots in residential areas in Thames Valley, which were very surprising to have harm spots in suburban single-family house neighborhoods. But certainly a lot of it was domestic and child sexual exploitation. And that way of thinking about the appropriateness of different strategies for outdoor and indoor crime may be more fruitful in some ways than other ways of dividing it up. Nonetheless, it sounds to me like there's a lot of room for the many analytically trained people, which is growing in policing every day, to dig into questions like that, and perhaps even into the redesign of the crime incident report. So we can tick all those boxes and have the robots say no if you don't fill them all out. As in, was this an outdoor crime or was this an indoor crime? Was it on the street side or was it the back garden side? All those fascinating things, which I'm sure are very far from the mind of the new, relatively new chief officers who are trying to use evidence-based policing, but they don't want to have to launch a redesign of crime reporting in their jurisdictions, which sounds to me like a, shall we say, a very long slog.
So, one of the things that is really important to do at the end of a day when you've heard a lot of evidence is to reflect, and in particular in this case to reflect with a group of chief officers whom one might argue their job is to actually use the evidence at strategic level. And I've mostly briefed. There's two I haven't yet, but don't worry, it won't be too much of a surprise. So what I thought, given this is a session for kind of putting the ideas that have been sat in the room together and to kind of round the day off nicely, is to get each one to tell a short story, and I mean short, ladies and gentlemen, a short story, because some of bear in mind that this is also apart from, for many of you in this room, a part of an apprenticeship in senior leadership, and some of you will have actually read the knowledge, skills and behaviours and note that one of the things that senior leaders do is they use storytelling to make a point. So this is a bit of a test of senior leadership to tell a story, and the story I want each one of you to tell is short and sharp, an example, a story of how you used evidence as a chief officer, and use evidence-based policing as a chief officer. And I'm just going to, because it's one of the joys of being the host, that I'm going to start, because it's just because I'm not still doesn't mean I wasn't. And start because it kind of sets the trend. This is going to be short, okay? So, a long time ago in a faraway place, Thames Valley, we got asked to do street crime in a world where there were a lot of targets. Beginning to get the drift, okay? Well, where there were a lot of targets and a great deal of central intervention. Folks, you're beginning to feel that heat? Okay, and because the government decided that crime was a very important thing, it wanted to intervene and it was worried about street crime robbery. One of the things that it did was to launch an initiative in particular which was about identifying priority and persistent offenders. And James, you're long enough in the tooth to remember this particularly interesting moment. Some of the others were at a lower level at that particular time and had it mostly inflicted on them. Dennis and I particularly remember this moment. It came out in a great fanfare. We had to identify these people. And my brief story is that what did we do? I got a Ph.D. from Oxford University to come onto my team to analyse what we were doing and to ask questions of whether what we were doing was effective. And I think that for me that was the big learning, because about 2 months later we had the first visit from the appointed, because we each got given those of the 10 of us who were the focus of this particular, I nearly said victims, but that was that's an alternative version. We got given a minister who turned up in full vigour to ask questions about what we were doing, and I let Emma, who was doing the research, loose on him to point out with her research in 30 seconds the fallacy of what they were trying to do. And there was a long pause and a gulp, and about 2 days later, they changed the definition to take advantage of what Emma had said. It was one of those moments for me, you have to not just do the work, but you have to position and frame the point where you're going to use it to leverage change. James.
Thanks, Peter. 15 years ago, a chief constable decided to invest in me and sent me on the precursor to this programme. Slightly different, I think. It was less applied when I came 15 years ago, which meant when I became a chief officer in Dorset Police, both me, the other chief officers I was working with at the time, and the generation of chief officers over the last 10 years in Dorset really believe in evidence-based policing. So not only do we believe in it, we've set up an evidence-based policing group to set our research requirements as a force, and we put our money where our mouth is throughout austerity. Every year we send 2 students. We're a relatively small police force. We send 2 students every year for this programme. And one of the things they're expected to do is to bring something back in their dissertation which we can apply locally. And the greatest example of that is Pete Browning. Bad luck, Pete, but Pete got the RCT around the controversial area of black and stop and search, where we are 22 times disproportionate in Dorset. A very difficult dissertation, but as you heard me speak about this morning, a really interesting area that requires an evidence-based approach. So that'd be my example.
And before the audience, both online and in the rooms, think that this is a moment to just have a quiet reflection, I'm going to be coming to you immediately. These four have done their stories. I want your questions to them about the application of evidence-based policing for real. And I'll use this group to answer some of those questions, okay?
Thanks, Peter. Can I go back a bit further? So a long time ago, when I worked in the Met, I was in Hackney, and it was in the era of the Met, which I know is long past now for currently serving Met colleagues, when loads of money would get thrown at a problem. And it's only now that I'm in Suffolk that I realised the approach that was being taken, which wasn't very evidence-based. But we were in Hackney, and we'd managed to achieve reductions spot on the target in serious youth violence of about 3% in 3 consecutive years. And everyone will know that it then gets incredibly hard to keep enforcing you out of the problem. And we had a very creative person who later joined as a direct entry superintendent, actually, who worked for the strategic partnership, who brought in Gloria Laycock to apply different shared approaches. And I remember it was a time when there was no money, and sitting in a room with everyone like it is today to say, we're going to take a different approach, take away all the overtime, and do kind of integrated teams using the evidence. I promise it'll work. And because she had a good sort of strong Liverpool accent, we all believed her that it would work. And we achieved over a third reduction with no money that year. So rather than the example from how I've taken it as a chief officer in Suffolk, I just wanted to say I think I've reflected on how an evidence, which I now know is an evidence-based approach, and bringing academics right in to change how you look at a problem can make a really massive difference, especially when you're hitting a wall and wondering how you're going to achieve further things.
Thank you very much. Good afternoon, everyone. So I was here from 2012 to 14 with Lawry and the team. And the one thing that I recall, certainly from then until now, and the journey I've been on in policing since then, is that applying evidence and trying something different to try and come to a position where you know whether something is more likely to work or not isn't actually that complicated. And it can't be complicated if it involves me, because I think very simply, so I apply quite simple tactics to the things that I sort of do in the workplace. So I'm going to talk about something briefly that we're doing now in the Met, and we're thinking it through, but we have put the wheel in motion to do this. So James talked a moment ago about disproportionality. We all know that that's very prevalent in the criminal justice system, but also when we talk about recruitment, retention, progression, and other aspects of disproportionality in policing, it's just as true. And trying to put your finger on why something might be disproportionate at times is quite tricky. So at the moment, I work with the Director of Professionalism, and professional standards and misconduct comes under my remit. And one of the issues we have, and we have a disproportionality gold group around this, is to look at why and understand why, if you're from a black and multiple ethnic heritage background, and you're a police officer, and you're accused of a misconduct issue, you're more likely to go through the formal process and get reflective practice. So in order to try and work that through and understand the decision-making point, and is that where the bias kicks in, is we've taken 2 of the 12 BCUs across the Met, and we're looking at basically when the complaints are made, when the conduct is alleged, is to remove any personal detail from the form that's assessed by the appropriate authority as to whether it's misconduct or it can be dealt with in a different way. And that will be, all the data is removed and it's sent to another BCU and vice versa from that BCU to the first one, so the decisions are made without any bias at all, and then to see after a period of time if there's a difference in that decision making. Because one theory is that because the decision makers are too I suppose, risk averse, and they don't want to be seen to do the wrong thing, they're always allocated to a formal process as opposed to dealing with it informally, which we know in many cases, the Taylor reforms were all about trying to remove from the formal process those cases that can be dealt with much, much more quickly and through reflective practice. So that's something that I think is an ongoing example now that I certainly wouldn't have thought about before I came here and started thinking about how we apply evidence. Now, where that sits on the Maryland scale, Larry, don't ask me, but I think it's on there somewhere. Thank you.
Thank you. Alex Murray, responsible for violence in the Met, or combating it. April last year, I went to a little bedsit in Edgware and sat on a bed next to a 16-year-old Libyan lad who had been on the periphery of 3 stabbings over the last year or two. His dad was sitting on the left. And I spoke about his life. I mentioned that we knew where he was, where he lived, but also that there's a number of things he could do to not continue getting engaged in violence. He shocked me, actually, this lad. He said he wanted to study economics. I didn't expect that. And I gave him a letter that had been crafted by some behavioural scientists, written by the local chief superintendent, that pushed the levers of reciprocity and social norms. But basically it made a lot of sense, and we were pushing on there, how safe have you felt during lockdown, and don't you want that to continue? And it was built on the idea that Barak Ariel, who should have been lecturing earlier, and a guy called John Denley, who was a chief super in West Mids, now head of cyber for the NCA, did an experiment where they knocked on people's doors in the West Midlands who weren't involved in serious crime in the criminal justice system, but we knew they were involved in crime. And it was a randomized control group where, versus control to the test, they basically sent a sweaty D around to say, look, we know you are, and stop it. And never expected to see any difference. But, a year later, a 35% difference in the prevalence of rearrest in the test group versus the control group. It's called I Heard It Through the Grapevine. You can look it up by Ariel and Denley. And it's a story, Peter, but the point is that I introduced a visit to 1,000 lads like that across London in the first lockdown because we didn't want to see violence stepping back to pre-lockdown levels. And then since then, we visited another 800 IOM violent nominals, just finishing now, coming out of the last lockdown. And for my approach to violence, we're really focusing on what we know is effective from a policing perspective, because it can be really confusing, violence, and complex. So, outside responding and outside normal suppression, how do we do problem solving more effectively? Because it's demonstrated to be one of the most effective ways of reducing violence.
Thank you. I told Peter I'd probably do this because I think you learn more sometimes when things go wrong than when they go right, actually. And that should never, ever put you off the journey that you're all on evidence-based policing, whatever you're looking at. And probably one of the things I learned most in one of the many experiments I've tried to do throughout my career was something around welfare for firearms commanders. And I had come across some research in the Netherlands, which was all about breathing techniques and something called HeartMath. And it had really popular, very good results in the US and the Netherlands. And I thought, this is what I need for my firearms commanders. So I got some funding and I took them on the course and they bought the technology for them. And it was a spectacular failure, I hasten to add. I'd done everything right, I'd done all the research, done all the literature reviews, and what I learned about that is I didn't get the buy-in at the very beginning of the people that actually it mattered to, and I didn't explain to them as much as it should have been about their welfare and how much of a difference it could have made. So I still learned something from that, and it never has put me off from trying to do experiments around welfare, because I think we do a lot around crime and people, but sometimes the most important work you can do is on your staff and making sure they're safe and they're feeling well. And well-being is definitely on the agenda now, and certainly we should be looking at the research and evidence base around supporting our staff and their families as well. So I think the point of my story is, don't let a bad experiment or something that doesn't necessarily go the way you want it to put you off evidence-based policing, because it's absolutely well worth the journey.
So, I think those were very powerful illustrations of the significance and importance of, and the reality. There are real things to be done here. You've had a chance to think. Let's start me off with some questions to this panel. Beds. So I'm going to repeat the question because to make sure that those who are online can hear it. So firstly, which is a good question, why did Alex go personally to see the young man in the bedsit? And secondly, what are the outcomes of that particular approach?
Good questions, Beds. See you later. Two reasons why I did it. If I'm asking our staff to do it, it's good that we do it as well. The second part is it had an impact on me, and it makes it that much more live for me personally. And I know how difficult it is when he's not in and I have to keep going back. What was the second bit? Right, does it work? Now, here you go. So I really wanted to, at the same time, we did a load of hotspots and we managed to RCT the hotspots. That's a really interesting, different story, which I might just throw in because it is. But I wanted to randomise these, but, sometimes I saw really good evidence and theory behind what Denley and Ariel had done. I had to go and do something now because lockdown was being lifted now, and I wanted to make an impact now, so we just did it. And we couldn't evaluate it. We couldn't randomise it. We are evaluating it. I've asked Jeff Barnes perhaps 700 times how the evaluation is doing. When he comes tonight or tomorrow, can someone from the audience please ask him as well? It might help. The hotspot trial had the best fidelity we've ever seen in a hotspot trial. Jeff Barnes managed it again. Something like 95% compliance for self-reported attendance at the hotspots. And then when we did the analysis, Jackie's bit, we didn't see any difference between test and control for violent crime hotspots. And just out of interest, we looked at the GPS data of the officers, and we found a significant difference between the GPS coordinates and the self-reported attendance at a hotspot. Enough said. But when you're talking about tracking, you really need to focus on that, I think. I'm not sure I'm going to be asked another question, so just while I've got the mic, I also chair the Society of Evidence-Based Policing, which co-sponsors this conference. Larry, thanks very much for that opportunity. You can all join in 10 seconds if you go sebp.police.uk. It'd be good to see you all as members. Thank you.
No, you get more questions. Yes. So the first one is, how do we create the time and space for people to think through, to enable some of this stuff to happen? The second one is, where's the database of what doesn't work? What's the mechanism for flagging that stuff up? Okay, I'm just going to partly deal with the second one because you raise a very important issue, and Dennis is flagging towards Rachel Tuffin at the back. But I'm going to put my hand up because I happen to be, and have been for the last 11 years, the general editor of what is now one of the top-ranked journals in criminology, let alone in policing, the Oxford Journal of Policing. And one of the things that I have learnt over that 10 years of publishing hundreds of articles is just how much the culture in academic publishing is against the idea of publishing things that haven't worked. And I actually was rejoicing today that two Netherlands colleagues, Terpstra and I can't think of the other colleague, but two Netherlands colleagues have just published an article about a procedural justice experiment in the Netherlands in which they tested observation of police officers undertaking street duties. They scored them for procedural justice and then tested the public response and found there was no correlation between apparently good procedural justice and effectiveness on legitimacy. Now, that's the kind of article that was really difficult to publish for quite some time. There has been a bit more acceptance that academic publishers need to publish things that don't work and to document why that might be, because knowing that a mechanism isn't linked to an outcome is just as important as knowing that it is. But of course, in the past, what we've tended to do is privilege articles which show that something works. And even then, we've allowed quite a lot of academics to get away without telling you how they did the experiment, what went wrong in the experiment, what were the things that were not quite so nice and gilded. And therefore, we've got a lot of experiments that don't replicate. So there is let's put our hands up from the academic community. We have to do better. And I'm personally very happy from the Oxford Journal of Policing to publish good research notes about things that were tried and didn't result, particularly with an experiment. I'm very happy to publish those. I'm going to try my audience first, and then I might give the College of Policing the opportunity to contribute, because actually you do have a significant role in this, I think. James.
Fail faster is my view. We talked about Saeed earlier, and Saeed and Black Box Thinking talks about failing fast. So how do we create the space to fail fast? We don't need to choke the whole system with massive programme and massive RCTs all of the time. There's a place for a full randomised controlled trial, but I think we need to be more innovative as well and be allowed to fail faster. And then, well, I won't steal Rachel's thunder about how we capture the failures. I like Jackie's story earlier about trying out a little thing with well-being, didn't work, learned from it, moved on.
So just to answer that question, it is really hard, and it's all about chief officer buy-in. So you have to have, if you're doing an experiment, whether it's an RCT or a smaller one, it's about making sure you've got that sponsorship. And I think as a chief officer, what you will try and do is, so the people we have on from a beds perspective, so the people that we have on this course or other courses, it's not doing research projects, support them as much as you can, get them the data. Sometimes you've got to be really courageous and say, just have it, okay? I'll deal with all the fallout later, just have it, just do it. So it's making sure that your chief officer really understands what you are trying to do, how you're trying to do it, and the value it will bring. It's not all about money all of the time. It is something around, look, if we do this, this will help your strategy. So sometimes you've got to be careful about crafting your research, but it can be anything from how are officers using body-worn video to a massive RCT. It can be any type of experiment, but you've just got to make sure you pick your right sponsor and explain why you're doing it and the value it will add to them.
Yeah, just to quickly, so Trevor, obviously, you're in the Met, so it's not necessarily directed at you, but I think all forces ought to have some sort of similar process. So we have an organisation learning board chaired by an assistant commissioner, and on that board, reflective practice and learning and research is very much a part of. And the strategic insight unit that Alex mentioned, Jeff Barnes earlier, as the acting head, he's on that, and his equivalent from the Mayor's Office of Policing and Crime sit on that as well. So talking about and thinking about and leading around all of the issues that are going on that are relevant in this sort of sphere. So, yeah.
That's the perils of muttering something when you're sitting next to Dennis. So I shall mutter out loud then, yeah. So three things. So the first one was about where you can find what doesn't work. So on the What Works toolkit, if you can look on there, if it's got 2 crosses on it, it means it doesn't work. And so the ticks mean it does, the crosses mean it doesn't. We don't actually, interestingly, don't have that much that is definitely shown to be harmful. There's far more in medicine and in other fields. That's partly because it's quite hard to get fidelity, all the things you've been talking about, quite hard to get things implemented to a really good standard. So you know you've really tested it, and it's not just because your trial somehow failed. Either it wasn't implemented properly or the evaluation wasn't good enough. So we don't actually have that many things that definitely don't work. Number 2 is, really good thing about systematic reviews on that toolkit is they go looking for everything. So not just published stuff, but reports what they call the grey literature, so the stuff that's in somebody's cupboard somewhere, somebody spots a trial that was mentioned online, they'll go digging and try and find the person who actually did it, even if it never got published. But if you're doing one, just have a record of it somewhere, even if you don't like publish it, because those things get picked up later. So even if it, you know, that's really valuable. And then the third thing, you know, I mentioned the violence and vulnerability programme. So those studies, a lot of those are quite exploratory, or they're looking like maybe they might not work, but they're just as, you know, I ran that, I did that thing myself. I read one of them and I went, oh, it doesn't really seem to work. And then I went, that's a good thing. We've tested it. It's a good thing. Yeah.
Yeah, and just as an interesting specific area, I mean, this is a challenging place to talk about the prevent approach after the experiences that the Institute has had over the last couple of years with Fishmongers Hall. But a very good question was posed by some of those in the process is, what do we actually know about what works in prevent in terrorism? And as Rachel's pointed out, we in this case is with my Campbell collaboration hat on. I'm one of the two principal investigators for a global program looking at what works in counter-terrorism and in prevent from the literature we know. And one of the biggest things about that is going and finding the failures. Because let's be clear, and I'm guessing the shared experience is it's the old one about success has many fathers, mothers, etc. And failure has few or fewer. And also, because we teach, Larry, I and a number of colleagues teach senior colleagues at the Indian National Police Academy when we're obviously not having a global pandemic. And one of the things that a number of them said to us very clearly is, the culture of policing in India, and I don't think, there's a lot of countries with this culture, is that to be associated with a failure is not likely to take your career forward and basically will shut it down, and therefore really difficult to be associated with a failure in those terms. So this is challenging territory, and the world of evidence-based policing has to get better at documenting and making sure that are available the things that have not worked, because it's just as much about if don't try this one, or don't try this one in this context, or if you do try this one, think about how you might improve on the design that was done last time. Next question from the audience. Yes, Simon.
What story do you tell the Treasury, and what story do you tell the HMR about your evidence-based stories?
Right, you might add the PCC into that equation. So what story do you tell the Treasury? What story do you tell the HMI? Yes.
So I worked on spending review in 2019 for 6 months, and I was the way the Treasury works is, and you may know better than me, Bas, but they are input. I found it quite encouraging. So when they're looking at the SR, we were trying to get the police message to reflect what the Treasury really values. So a lot of SR decisions are based on politics, but the bit that is based not on politics, on policy, the inputs, resources, inputs, outputs, outcomes. They're the four categories that a young civil servant in the Treasury going somewhere is obsessed about. And so we need to be able to persuade the Treasury how much money gets you what input, how many officers, doing what activity that leads to what outcome. That's an incredibly evidence-based question, and they are interested in causality. So I'm quite personally encouraged by the piece of the decision-making that is based on that policy. Obviously, there's loads of other political considerations in relation to spend. And then final point is, I think we have a policing minister at the moment who is quite open to evidence, as you saw this morning. If we look at what's called GRIP funding now to deal with violence coming out of the pandemic, it's incredibly evidence-based. It is prescriptive around hotspots and problem-orientated policing because it's based on, they want to put money on the evidence of what's effective. And you have to, and the chances of you getting money was based on the quality of your evaluation. They recommended an RCT, and you have to report back every 2 weeks on how you're spending it along those lines. So, albeit the reporting requirements are quite heavy, I'm quite actually encouraged.
I was just going to make a comment around HMIC's approach to evidence in the last couple of weeks around domestic abuse homicide. Wasn't it, Larry? I think you sent me the Times article. I agree with Alex. I think the Treasury has a forensic look at evidence-based policing because they want to see the pound signs and the cost of everything and how much every outcome costs. We saw the article in the Times where an HMI was purporting that the domestic homicide rate was 3 times what it actually is. So I think there is a problem.
Yeah, just from our experience as a What Works Centre, we're always getting called in to talk to people in Treasury about different things. The worrying bit is the turnover, because they're always about 14 and they're only ever there for about 6 months, so I'm exaggerating only slightly. So you're on a revolving door. You have to constantly tell the same stories over and over again. But what's really positive is that they're embedding it in departments' planning, and the questioning that they do with departments is the level of kind of scrutiny is increasing all the time, so that if a department doesn't have the evaluation, they should be showing evidence of building it into their spending plans for that new year. So if they don't have the evidence, well, how are they going to get it? Of course, the risk for us is always a little bit too, though, that the evidence base is quite strong for other departments to have money to reduce crime. And so there's always a bit of a balance there, because we need to make sure we've got what we need for other kinds of activity, for hidden harms, for counter-terrorism and so forth, which is less clear sometimes. Yeah, sorry.
Just reflecting a bit more on the HMIC part, and Suffolk have just had one of the new pilot approaches to HMIC, and the inspection team came in during COVID, and I think our biggest reflection is don't tell a story, because all your frontline people are going to tell the real story, and if they're different, it looks terrible. So what we did was we gave them, the whole team, laptops and kind of indicated where they could find things and let them discover it, rather than trying to do a kind of a glossy, look how great we are, and we kind of lock the skeletons in the cupboard. So it seemed to work really well, and we had a great sort of discussion, and the areas that they identified were entirely the areas that we felt needed addressing as well. I know chiefs of the past had similar standards of integrity, of course.
We did. Mostly. Yes, Larry, go on.
As a native of the colonies, I'm too familiar with Australian, US, Canadian warfare over evidence-based policing. So we're not just talking about people saying, I don't believe it, we're talking about people saying, I'm going to get you, because you're the enemy. You're on the wrong side of what I deeply believe in my culture war, which is that we don't use evidence in this job. We make our decisions based on experience. Does that ever happen in Britain these days? Or did it ever?
So the question for the online audience is it ever been the case that experience has been given preference over evidence?
Well, not exactly.
I was going to say, but in a way that is simply indicating that an evidence-based approach doesn't fit the culture, isn't part of the dialogue, and has no validity or legitimacy. Yeah.
I think there are pockets of it, to be honest, and I think it's much better now than it was. I've certainly had discussions, we don't do it that way, academic, you're the clever one, we don't want you in the room, all of that sort of stuff. So it has happened, but I think as a collective, I think you've just got to look at the popularity of these sort of courses, the people you've got sitting up on the stage, the way the College of Policing has brought, what works together. So it certainly has changed, but it certainly did exist. And I think you're always going to have people that will be scared of people that have got evidence or want to try something different because it's not the norm and we've done it this way and this is my professional judgment, and it can be quite alienating for people that haven't come from that, haven't had the privilege to have what we've had access to. So I think it's about sharing and talking about the narrative, and we all join policing to make people safe, and that's what these programs are all about. So I think if you can find that shared understanding, how you do it and have that narrative then advances the cause of evidence-based policing. That's my perspective.
Yeah, and I think it's a real fertile ground in the UK, but there are people, you know, there's this false dichotomy, University of Life versus Ivory Tower, and we've just got to break away from that. It's how do you meld great experience with the evidence of what's effective, and that's how you sell it. And I personally, how you frame it in the workplace is really important. Our ends is, you know, less crime, less violence, less harm. So you don't need to call stuff academic. You don't need to call stuff even evidence-based practice. You can just say, look, this really worked here. Know your audience. This really worked here. Let's do that.
I'm just going to ask you one question to wrap, to give it a kind of send-off. So, and just on Larry, my sort of personal story on that one is on the Harvard session on policing and public safety, when David Weisbert and I introduced our paper on police science, the new paradigm, which was about evidence-based policing. And after I'd finished speaking, Bill Bratton said, but Peter, you're not like other chief constables, you read the science. And I thought, well, yeah, but hang on a minute. The whole point is we can read the science and we can use it.
I thought you said don't read the sun.
Science! Never, ever have I read the sun, okay? Jesus. God almighty. Right, so on that almost apoplectic moment, what did I invite you up here for? Okay, so, yes. So just give the, and particularly for this audience and for those on the online, just a final reflection for this panel on how can we ensure that, and it's sort of the other side of Larry's piece, how can we ensure that, and many of you are about to try and do this, I believe, how can we ensure that this next generation of chief constables and the next generation and the current generation of PCCs use the evidence in the way that you aspire to?
Building on my opening, Peter, you need to invest. I think there's probably 24 Cambridge alumni in Dorset Police at every level. We've got 2 inspectors, chief inspectors in the audience. Pete is graduating this year as a superintendent. These are our future chief officers and chief constables. You need to create a culture so it becomes business as usual, that everybody uses police science in their application. And in fact, there's a moral and professional obligation to do so, because I don't think we have room in policing to waste resources on things that don't work. And can I just say one final thing, which is the first time I met Alex Murray, he explained, he was given a lecture in Dorset for us around evidence-based policing and talked about the classic misuse of taking young people into prisons to show them how, how they should not get into offending, and it was shown to be counterproductive. Yet the fantastic TV programme Time, I was really depressed to see young people in the prison being talked to by prisoners. It shows that it's still quite popular, those kind of myths.
That has reminded me that the first time I met James, you might not remember it, we were going for an HPDS assessment, and we had a template like you all use now, and it didn't work. And he came out of a briefer and he went, don't use the bloody template, it doesn't fit. So I screwed it up, went in, and he was right, it didn't fit. So it's a great bit of evidence, it doesn't have to be a massive study. Two things. He failed fast, which was great for me. You did actually pass it, didn't you? But didn't you? two things. PEQF. So long term, we must remember it's a continuum. We're master apprentices, but the apprentices coming through now are going to be evidence-based from the inception. So those futures, that's enormously positive. And I think the second thing is the kind of democratization of people checking things and having information themselves that they can just Google and check in different ways is naturally pushing us in that, rather than people controlling the data in hierarchies.
Thank you. As we've been talking over the last sort of half hour, so I've thought a fair bit about actually the oversight and governance of policing. And I mentioned MOPAC from a London perspective, but actually PCCs I think hold a lot of influence, particularly around how the money's spent, how the priorities are set, and the appetite, not necessarily operationally, but organisationally, of what there is to extend this thinking and take those calculated risks, because it is risks, because more often than not, in policing, the operational demand is people want results now. They want you know, if we're going to invest X amount of resource, capacity, capability into something, they want a result there and then. And this doesn't allow for that, not necessarily, not if we're going to do it properly, particularly things like Alex talked about in terms of violence focus in London and elsewhere. So I think PCCs and mayors are the areas that we need to really focus on to show them how we can get bigger bang for our buck by focusing on what works and what doesn't work, not focusing on what doesn't work.
Thanks. So I'll come at it from the other end, which is, so you need that governance and structure, but with us, we need enthusiasm and curiosity and the ability to try things out and, you know, embryonically just push things that really interest you and get your staff to ask questions. The more curious we are as an organisation and bravely curious, you know, so how much does that cost and how much does it reduce crime? It's a really good question. The cost benefit, because it immediately makes you evidence-based. So all of us responsibility is to make sure our staff feel empowered to ask questions about what's effective.
I think there's something around role modelling here as well, around the difference that you can make. And I don't know if she's still here, but I look at Michelle, and there's many that we have, you know, many staff that we've supported in beds that I've known of. But Michelle's a member of police staff who has led an RCT in community policing and patrol and having to deal with all of those sorts of issues that she alluded to, and there was a lot more that she did. And then to suddenly do that, then to be speaking to a police minister, you know, what a great role model she and many, many others have been. So I think there is something around role modelling, the difference that you can make at either just a local or even national scale, and I think that is what will win some of the sort of the battles that we have around evidence-based policing.
And I think that is a very nice point at which to finish the afternoon. I can see Larry's wandering up. Did you want to say something as we finish, Larry?
Well, I want to thank Peter Nehru. I want to thank the entire panel for really candid comments. I think that there's no better evidence for how far we've come in thinking reflectively and, if I say it right, reflectively and potentially critically about how to do things in policing better. And I think it is true, if not universally acknowledged in other countries, that we are here to prevent harm and protect the public as a kind of primary motivator. It may be truer within this room than perhaps in some other realms in which there are maybe other motivations, other interests, other cultures. But I think the idea of critical mass and perhaps to cite James Vaughan and the number, which I didn't even know, 24 alumni of an evidence-based policing program in a police force of approximately 1,000 people, that's huge critical mass, especially within the leadership ranks. And if other forces came anywhere near that, they'd be getting close to Barry, Canada, which I have to point out is represented in this room in a police force of, I can't remember exactly how many, but I do know that, how many? 220. And how many have taken an online course in evidence-based policing, Rich? Oh, about half, right? So about half the police force has taken an online course in evidence-based policing, and guess who else is enrolled in the course? The mayor. But that's a critical mass that I think is going to be hard to reach with 50,000 people in a police service. Nonetheless, I think today and yesterday have made me feel more optimistic, possibly because COVID has really sort of unfrozen things in ways that we'll hear about tomorrow morning when we start considering a model in which most policing is done by video response rather than by automobile response. And that may be the world that's coming on better and certainly faster because it's been tied to this group of people and the people who are online today, and we want to thank them for being with us, but especially thanks to the leadership that has supported and led on the ground through all of the difficulties and the challenges of getting things done, which we not only appreciate, but we're sort of awestruck at how much you're able to do. So.